so much. Good afternoon, everybody. It's hard to talk about healthcare and fitness and look at all of you sit for hours and hours and hours. I am, as you heard, Lila Lazarus. I was an anchor health reporter for 25 years in Baltimore and Boston, and finally came to my hometown, to Detroit, to anchor and health report, to be closer to family, which was way overrated. But anyway, I am also the person you're talking about. I'm the former couch potato, the person who wasn't engaged, wasn't involved, was a lot bigger than I am now, and one day did a story on a man with no legs and realized I had never used my own. So I started to try to walk 1 mile until it became 2 and 4 and 6 and 8, and since have run 12 marathons. You can applaud now. Okay, good. I didn't know how to swim, but I wanted to, so in June, about 7 years ago, I learned how to swim, and that September swam the Straits of Mackinac, 5-mile swim. You can applaud for that, too. Yeah, good. I'm telling you all of this because every single person has that on switch, and that's what we're looking for, the on switch. For me, it was the guy with no legs. It's the thing that the doctor was just talking about, that about me. For some reason, that became my about me. And I wanted to inspire others. I was always about, after that point, inspiring others. She mentioned her favorite thing was colonoscopy. I did my colonoscopy on television, same day as Katie Couric, prime time. In case you forgot what a colonoscopy is, that's when they go in 6 feet through the back door. I did that on TV. My husband at the time said Detroit saw more of my behind than he did. And we're not married anymore. But anyway, I'm also now a yoga teacher, so I'm really devoted into getting people to engage with their bodies and to inspire people to move. Governor Granholm and then Governor Snyder heard about my escapades and appointed me to the Governor's Council for Physical Fitness, me, the former couch potato, and I'm very proud of that. This past week, I went to the Bob Seger concert. It sounds like, where am I going with this? But I happened to notice all of my fellow baby boomers were fairly large. Not only are we getting old, but we're getting bigger. And the concert wasn't sold out, but it sure felt like it was sold out. And it occurred to me that these people need that on switch, that inspiration. Driving here, the little light came on in my car that says I need more windshield wiper fluid. So of course I drove right in to get more windshield wiper fluid. The light will go on and tell me that my tires are low and I'll take care of it. The light will go on and say I need oil, I'll take care of it. Well, our lights are on and we're not taking care of it. So the question is, what do we have to do? We have two amazing panelists who are going to give you wonderful ideas on this issue. What are the best ways to engage people in their health and their health care? The first is Dr. Joyce Lee, who took a moment from tweeting and blogging to be with us, a pediatrician, diabetes specialist, researcher, associate professor of pediatrics at U of M, passionate about patient-driven participatory approach to creation of health and healthcare systems, an incredible resume of training and research. I'm just hoping that you understand her language because she uses words like echophone, paste spot, little pork chop, bulk buffer, and things maybe you understand or maybe you don't. She doesn't just use Twitter, she really hits the tweet spot. So please welcome Dr. Joyce Lee. Our second participant, Dr. Dee Edington, a PhD, founder and chairman of Edington Associates and founder and professor of University of Michigan Health Management Research Center, spent 25 years in academic administration, trained in mathematics, kinesiology, biochemistry. We, by the way, have shared schools, as he taught at UMass, where I did my first master's, and the University of Michigan, where I did my second master's. Again, incredible resume of training, research, focusing on the precursors of disease and vitality, workplace wellness, the impact of healthcare, cost containment, productivity. He's authored and co-authored more than 800 articles and books. Are you tweeting this, by the way, right now? Okay. Please welcome Dr. Dee Edington. So I'm going to give each one of them 5 minutes to give their share of actually how we're going to engage people in their health and healthcare. Then we'll have a little discussion, and I really am encouraging you to come up with your questions. This is your moment. If we really are going to come up with answers, the best thing to do is to first ask the question. So please, as you're hearing this, think of your questions. And I tell both of you, if you go beyond 5 minutes, you too will have your colonoscopy in public. So go ahead, Dr. Joyce Lee.
Do you have the clicker? Right, thank you. And
steps. Energetic.
All right, so I thank you for that very generous introduction, Lila. So I am a clinical health services researcher at University of Michigan. I specialize in pediatric diabetes in particular, so work with children and families with type 1. I co-direct a mobile technology program, and I am very embedded in diabetes online communities because I think it's a very rich source for engaging patients in the creation of care. I also am an NIH-funded researcher and have an opportunity to work with colleagues from Cincinnati Children's and the T1D Exchange to create a learning health system for type 1 diabetes, really population-based health for a multi-center network of clinics that care for children with type 1. So I would say that I design at multiple levels, at the clinical level, at the research level, and at the systems level. I want to just mention that I have no ties to any pharmaceutical companies. I am paid to be social media web editor for JAMA Pediatrics, which is a peer-reviewed journal in our field. But I want to sort of share with you this whole notion of social media. So I actually have identity online, and I call myself doctor as designer, and that's because I really believe in design thinking as a really powerful tool for engaging patients, healthcare providers, and stakeholders in the healthcare system for transformation and innovation. You know, I think this is the picture of a medical designer that you might have in your mind, right? It's Johnny Ive, who's making the newest Apple Watch. But I want to kind of put forth this notion that we actually are all designers because we're all stakeholders inside a healthcare delivery system. I had, the great fortune of going on sabbatical 2 years ago to Stanford and brought my kids with me and had, my kids actually have life-threatening food allergies. So they actually have to use an EpiPen to take care of, or sort of to protect them from life-threatening anaphylaxis. And so I want to share this story with you, not because it's something that I designed, but it's sort of a way of thinking about the world and a way of thinking about healthcare design and delivery that really kind of permeates the way that I approach my work going forward. So if you go to the peer-reviewed literature, if you even think about the conversation we're having here about patients and healthcare, right? We talk about patients and their debilities or their weaknesses or their inability to sort of care for themselves, right? You go to the literature and it says patients don't really know how to use this EpiPen, right? And the EpiPen, I don't know if you've ever used one, but they're the most confusing, poorly designed thing that you've ever seen. You pull the cap off one end and then you have to put the needle in the other end. So a lot of people actually inject themselves unintentionally every year. And in fact, there's a lot of healthcare providers who do this on a regular basis. So it's not just sort of the uneducated layperson. Two, right, there's this notion of, patients or children are not using their medications or their EpiPen devices, right, because of this fear of needles or injections, right? And, it's really scary. This is my son, right? When your child's life is on the line, you're not clear about how to use this really complicated device that doesn't really have a great design, and you're probably going to make a mistake when you do it, right? But again, we sort of frame this as a patient problem. And then three, patients forget the device. They allow it to expire, right? But, it's kind of big, it's kind of fat, it's like a big Sharpie. It doesn't really fit in your purse, right? So the aesthetics do matter. And what happened when we were on sabbatical is that this new product came out from Sanofi. I don't know if you're familiar with it. It's called the LVQ, but it's basically a redesigned EpiPen, right? And it's the same medication, it's an injection, right? But it really transformed the way I think about healthcare and the way we should be approaching healthcare and our patients, right? Again, I kind of pose the question, is it a healthcare problem or is it a patient problem or is it a healthcare system design problem, right? So what they ended up doing was they ended up redesigning it so that the cap comes off one end, right? And that's the end that the needle goes in, right? Two, they actually took a really stressful situation. It actually has a voice-activated control that speaks to you, and it tells you how to use it. It says, place it in the thigh, because you're never sure where to put it. It tells you, it counts for you how long you have to leave it in, right? And it instructs you to seek medical attention. And then three, it's just, it's more aesthetic. Like, it's smaller, it's thinner, it fits in your purse, right? And what's sort of interesting about this device is that it was actually made by brothers who had food allergies themselves, and they didn't like the devices that they were using, right? So from this personal experience, from other sort of interactions I had with designers at the D school, I sort of came to this conclusion that, you know what, patient problems are really design problems, right? And that, you know, you fix the design and it's actually no longer the patient's problem. And if you let patients and caregivers design, they will actually fix the problem for you. So I'll take a pause there.
Good. Yeah, you gonna breathe too?
Can you, oh yeah, great.
Is sign on? Okay, can you hear me all right? I'm back there? Okay. I just asked Joyce that now she can take a breath. Let's go to the next, oh, I got it, yeah. This is a slide I use for every talk I give. It's easier to find new audience and new talks, so I just... The top is the topic of the next book that I'm coming out with in July. Shared values, shared results. That's the primary theme. The second theme is positive health as a win-win organizational philosophy. And the third theme that's not up there is measure what matters, and measure and communicate what matters. But I think that's where I've got to after these 38 years of studying. I started in 1978 in this field, and there was no relationships published between health risk from a Framingham study and costs. So we knew there was some relationship with disease, but not with costs. So we started out on that track, and it took some time to do it. But I think the goal here is what's the realizing the promise and competitive advantage of a healthy and high-performing workplace and workforce. And the difference in what I was doing and what I'm doing now is the workplace, because I think it starts with the workplace, not the workforce. It's not people, it's the context, and that's the community or the workplace.
The green one.
Oh, blank. Next. Yeah. Okay. This one slide represents all the work we did over this 37 years. And this slide, there's a couple hundred thousand people on this slide. And the blue bars are the low-risk people. We give everyone 0, 1, or 2 risk. I think risk travel in combinations, so it's not any single risk. So that's the blue bars, and you see as age goes up across the bottom, costs go up, which is the vertical bar. And so that's the low-risk people in different age groups. And then the white bars are people we don't know about. We know their age and we know their costs, but we don't know who they are and so forth. So we can put them on this graph. So they're a mixture of all other risk factors. Yellow bar are 3 to 4 risk factors and medium risk, and the red bars are the high risk factors. Every population we've looked at, we've got 2 million people in our database. We had 34 people in my research lab at that time, and 2 million people in our database. We're tracking them for a long time. We started with Steelcase in 1982 and went for a 20-year period, and General Motors and Progressive and others are equally as long. The red line is the natural flow of Americans. And in all these years, I've not seen much of a change in that natural flow. When you put everybody in, all that take health risk appraisals, but we don't know what kind of wellness programs they're in. But that's the natural flow. We get older, and we have more risk. So risk go up, and age goes up, and that red line continues to go up. So there's a terrific demand that's facing us here. Well, after that, I just wrote a copy just in case you haven't seen this. There's 22,000 copies of this out there, but probably not many in this room. When I finished that work, I put it in a capstone book, and it's called Zero Trends. And health as an economic strategy. Health is a serious economic strategy. Because I think health have a lot to do with success of business and success of Americans. But then I started thinking around, what is health? And I think we all know what health is, but I think none of us know what health is. So when I finished that book, I go to London quite often, and between Heathrow and downtown, there's this sign that I thought was an interesting sign. It's actually a sign for a product, but I think it's a sign for the country, because the UK is looking into other ways to measure success of a country other than gross domestic product. And Bhutan was the first one, and they use happiness as their measure. But change your way of thinking, embrace new points of view. And I think that's going to be the smart people in the world who can learn and unlearn and learn again. Because we don't know it all, we will never know it all. Health is in the clouds, in my opinion. We're learning more and more. I asked people, how long ago was we thought the world was flat? Anyone here think the world's flat? How many people think that the sun rotates around the world? You know, it wasn't too many years ago that people thought that, maybe 400 or 500 years ago. People thought that. So we think we know about health. What do we think it's going to be in 200 years we know about? So we got to start thinking of new ways. In those 34 years, 37 years, we were looking for thriving employees. What is a good employee? What is a healthy employee? And we thought it was around risk factors. So we looked a lot into the individual, all the risk factors. That was the slides you saw. What else is there? What else is there inside of your head that might determine your health? How happy? Happiness? Attitude? Resilience? Creativity? Optimism? All of those have an impact on our health. In fact, I think everything that happens in an organization impacts your health. Everything. It's just not risk factors. Risk factors only explain 25% of our variance in healthcare costs. And I don't want to measure healthcare costs anymore. I want to measure utilization or some other measure, not costs. Whether it's productivity, whether it's disability, whether it's whatever. What about the workforce? What about the workplace? Does the workplace have anything to do with your health? Absolutely. Toxic environments, a bad supervisor, unknowing supervisor, just making bad jokes. Supervisor probably has as much impact on your health as anything else in the workplace. Policies and procedures, of course, also. So we put those into some kind of a, what I call a living and thriving instrument. What about your family? Your family have anything to do with your health? Sure. Is it a great place to be? Is there love in the family? Can you go home and regenerate yourself? What about the community? Is it a good place to live? Community has something to do with your health as well. So as Joyce talked about system design, we think about system design as we design our new workplace. Systems design and systems thinking and design thinking all have to be part of the new way to think about things. Your leadership skills, I would ask every leader in your organization to answer these 6 questions. Do people trust you? And Jan talked about some of these things. I think this whole area is around trust, respect, relationships, shared values, shared results. Do you treat people with respect? Respect is what people want. Employees want respect. Many companies have a toxic environment and don't treat them like that. Much of the poor health begins with good health. And I won't go through the rest of them. You can read those.
Good, because you're about 1 minute to a colonoscopy, so we got to hold off.
Well, I'm due for one, so...
All right, that's good. TMI.
Oh, bring it on.
I love it. I love it. Thank you so much.
Let me finish this. This is system thinking. This is where it takes a village. I know that's a phrase that people have all heard, but it does take a village. Senior leadership, all employees, dependents, all shareholders, all stakeholders, supply chain, customers, communities. It takes everyone to have good health. You can't do it by yourself.
What's really exciting is inside this room, we have the movers and shakers who can really make the difference. But first, they need a little inspiration. Many of us have worked in those toxic work environments. I know I have. I worked at 9 different television stations. One of them I'm thinking of particularly toxic. They had a disease in that newsroom called, you're in healthcare, you probably know it, rectopsis. It affects the rectum and the optic nerve and gives you a really crappy outlook on life. So the question is, when you're working in these environments, there'll be good people, there'll be bad people. But you're all about designing medicine. You're all about taking on new points of view. So let's say everybody in here is on board. They want to redesign. They want to take on new points of view. What are your top 3 suggestions? I'll start with you, Dr. Lee.
So I think participatory design is really sort of one of the keys to, I think, organizational success. And I think that the problem with healthcare is there's very much a culture of, can I steal my slides back?
Oh, that's right.
Yeah, thank you. You switch over. You know, I think there's this culture of where we're systematically, I think, eliminating patients as the key stakeholders, helping us redesign our systems, right? We talk about patients as problems, we talk about patients as receptacles, but like we should really be thinking of them as equals to help create the tools, technologies, and systems that we want. And I think when people think of patient engagement, they think of, you know, the hospital looks like a hotel. It's modeled after the Ritz, and that's one piece of the experience, right? But I think it has to be much deeper in that you really need patients as partners in the actual decision-making and higher-level strategy of a health organization or a workplace.
So give us an example of how you would do that.
You invite them to the table. I mean, you know, so we have a collaborative called Health Design by Us. We've been doing all sorts of collaboration between patients, healthcare providers, administrators, actually individuals from other kind of schools, like technology experts, like School of Information, Art and Design, right? And I think one of the biggest sort of barriers is that, you know, you talk to anyone who's trying to redesign, say, an ER workflow, you know, like I've had physicians say to me, what possibly could a patient offer to that insight or to that sort of workflow process that we're trying to develop? And it's like, well, they're at the center they should be at the center of your design process because they're the person who's experiencing that healthcare experience, yet we don't really systematically even bring them to the table.
Well, when I talk about health, and I don't talk about the sickness care part, and doctors don't like to hear that, but that's what it is. And health is here. I'm on this side. And so on this side, how can we go from health to what I call positive health? How do we get there? Because health is not good enough, the way we understand it. We have to go further than that. But it comes up pretty much what Joyce was saying, is talk to people, ask what they want. Many times wellness, they hire wellness, if they want a wellness program, they'll hire a wellness program, and they'll design a program, and then they go to the employees and say, here's what we got for you. And then you have to pay the employee to do it. What kind of industry is that? Why do you buy those things? You buy a product, then you have to pay your people to use it. That doesn't make a lot of sense to me. So ask people what they want. One physician was consulting a person about weight loss and talked about it, do this, do that, and the person said yes, 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 and she went off. 2 weeks later, she came back and says, well, you do it? No, I didn't get through it, but here's what you do. Third time she came back, and she said, no, I haven't done it. And the physician finally said, well, do you really want to lose weight? And the person said, no. Well, hell, just ask them what they want and ask them what they need. People know. Before, somebody asked it, you know, does everyone know what about exercise? Do you know about weight loss? Yeah, everyone knows. But how are you going to make it happen? And everyone may have a different view, but if you get all the views together, then you can design something.
And the one thing I would say is it's not about a customer engagement survey. It's not some foreign thing that you take on a Qualtrics and then someone tells you the statistics later. It's like sitting in a room, going through the design process, which is about empathy, and it's about identification of problems with the user, helping you really define what the issue or the problem is that needs to be solved, and doing ideation and co-creation together. So can you have the CEO? Can you have the higher-ups, in addition to the minions, right, to work together to find a solution? And I would guarantee you that engagement is going to be much higher if it's a solution that they actually helped ideate and create.
And we're talking about two different things: getting the patients involved, but also getting the top dogs.
Yeah. And I mean, I think it
involved.
works. I mean, I think it works for workplace, as you know, and wellness, as well as it works for patients in a healthcare delivery system and the providers that work with them to care for their chronic disease. I mean, I think it's a universal process that I think we generally don't leverage in the arena of health.
I don't know how many of you in here are the top dog, so I don't mean to offend you. I just know in the stations that I've worked in, the top dog was not the person who was encouraging us to get healthy by running the 5K, him or herself. And so over and over, it reminds me of when we were little and there was that TV commercial, well, this is how old I am. The guy smoking saying, I don't know why my son smokes, and not understanding his role as inspiration. And I think we have that in our CEOs as well. And so how do you inspire the CEO to inspire the rest of us?
Well, I'd hold them, first of all, I think a lot of CEOs are doing this now. There's been a major, major shift. And CEOs are sometimes leading the charge. And I see that in several companies. I think he's heard an example today where that's true. I think you hold the CEO, they say, well, what's the most important part in your organization? Almost all of them say the employee. I said, well, interesting. What are you doing for your employees? How are you leading your employees? Just hold them responsible for it. And they get it. And in fact, at Trinity Health, I knew someone there in Columbus. And she was leading the wellness programs. And she was in the meetings at a pretty high level in with the CEO. And he would always get up about 11:45 and leave, and people wondered why. I was going to the bathroom probably. But she knew that he wasn't. So she just happened to position herself one time next to the elevator when she knew that's where he went up the stairs. She got in the elevator with him and she said, Tammy, how are you doing? What can I do to help you? But I pay you, I give you all the money, all the resources. And she said, yes, you do. You're very good at that. But one thing you can do, when you're in the room and you get up and leave, tell people you're going to exercise, you're going to work out. And he did it, and he got so many positive responses that he said, Tammy, what else can I do?
And you mentioned Tridia, the head of St. Joe. Rob Caslew was a bike rider, and so the most recent commercials with Rob Caslew in St. Joe is him actually riding the bike and inviting people to join him, and we have these Join Me lunches. Part of the Join Me lunches, somebody said at one of the lunches, I don't really care if my company says I should be healthier because, as we said in the last session, they never give me time. There's never time in the day for me to actually do something about it. I get the idea, I get the point. When are you going to give me time to actually work out? So is the answer to do these 15 minutes at lunch, to start the meeting later in the morning?
Sure, that's part of it. Somebody may want to do it in the afternoon, so they've got to give them flexibility to take that. They have child care problems. How do we get the people that are taking those? How do I get to the doctor? Doctors only work when people work. Doctors don't work when people don't work. So it's pretty tough to get there. Now it's changing, thank goodness.
Now, one of the ways that you've suggested changing all of this, Dr. Lee, is to get people more involved in social media. And you've actually gone on to say that social media, Google, and the internet are medical therapy. Can you explain that?
So I want to share with you. So I work with patients with type 1 diabetes, and this is the level of technology that we actually have in the clinic, right? We have incredible technologies like continuous glucose monitoring systems that give us a glucose every 5 minutes. We have a slew of glucometers, we have insulin pumps, and this is the technology we use, right, to do data visualization and to do health communication in our current healthcare delivery system. So I don't know if you're familiar with this at all. This was actually a patient story. These are friends, I guess, community members, because we're all part of a type 1 diabetes community. But it's called the Night Scout Project, and it was something that started with the Active One dad. So he is a father of a 4-year-old with type 1 diabetes. This was recently featured in the Wall Street Journal. And what he ended up doing was getting frustrated because, diabetes is lots of sensor data that we're collecting on our patients on a daily basis. This isn't even sort of out there in the future about wellness. This is like stuff that we're using for insulin management on a daily basis. And he was frustrated because that little blue receiver at that bottom left-hand picture, he couldn't get to those numbers when his son was at school because there was no mobile technology solution that would take those numbers to the cloud so that when he was at work, he could actually access to make sure his son was safe. So what he ended up doing was hacking the FDA-approved continuous glucose monitor. He hooked it up to a 3G iPhone, got the numbers to go to the cloud, and then he tweeted about it. So he tweeted about it. There were other dads on Twitter who have kids with type 1 diabetes who are also engineers, and they ended up creating a whole bunch of solutions together. So he shared the code, made it open source. People made iOS apps. People made care portals to record insulin doses in addition to the glucose visualizations on a desktop for the school nurse. That people had Pebble watches that they could sort of just glance at their watch and see their son's blood sugars, right? And this kind of went viral in the community. So there were some people in the community who started this thing called CGM in the Cloud, which is a private Facebook group that now has 12,000 members within less than a year. And those dots are actually people that are using the technology across the globe. So, open source code, patients understanding and needing a solution, right? And social media, a technology uniting people across the globe to create really innovative health solutions, real patient engagement. I don't know of a clinical research study or a company that can gather a community like that in that short a period of time with that intense a passion. But I think sort of this whole idea of the maker movement and DIY health and DIY medicine and giving people the tools to be engaged in their health can really make a difference. And this is just an example that I've seen in my community, which is pretty transformative.
So you're really encouraging doctors to embrace social media and not to ignore it.
Absolutely not.
Especially Twitter.
So, and I just want to say I have this blog post called We No Longer Live in the 1990s, right? I mean, I think the Night Scout community is an example of how social media actually does represent medical therapy, because that is how the therapy was disseminated. It was not disseminated through a healthcare delivery system or endocrinologists. Like, most endocrinologists don't even know about this community, right? But that is the power of social media, and I think that is something that generally the enterprise, particularly in healthcare, but probably in other arenas too, like social media is a chore. It's I have to do this. It's this dangerous, scary thing. But in fact, I think there's incredible opportunities for patient engagement using the technology.
Give us your success stories. I really want to hear from you in terms of getting people engaged or involved, or what the challenges are in getting people where you are engaged and involved. And then we can hear from the experts. Somebody here, come on. These are the people that we're looking to come up with the answers inside healthcare. You must have answers. You must be, and questions. And you should be engaged. Yeah, go ahead.
Hi, Laura Umpel from the Michigan Hospital Association. This isn't an answer, but to look at the Night Source project and then to think about the general design of health IT, it seems pretty clear that nobody was engaged there, at least not the people who were actually going to use it. So there's so much, I think, among both providers and payers that believe that data is going to be very helpful. But could you comment on what we need to do in terms of design to really get to a point where data is helpful as opposed to a bunch of software?
Yeah, I think I just want to share something. So, I think people have touched on it today, just this, sorry about that, this whole notion of systems designed for healthcare. So I think, Richard Gilfillan talked about it with Iora Health. That was an example that I have here. Really, there's this whole notion of how do you really transform healthcare delivery and payment to allow for the thriving of your patients with chronic disease, right? So in the case of diabetes, like my patients come and see me every 3 months, but honestly, that doesn't do much. They see me for 15 minutes. We write down the blood sugars off the glucometer. We get a measure of their glycemic control. But like all the diabetes is really managed back at home, right? With school, with family members, with dual households, right? And the problem is that we don't have the tools to give them kind of closer contact with us or support from us, right, for real-time notification, because we say, call us and we'll call you back in 48 hours. And two, we just don't have those technology systems that allow us to leverage that data, either for research or for clinical care or for giving real-time feedback back to our patients, right? And so I think there's a growing recognition that population health is important, but what's happening is that it's happening at a very high level. Like you have a Trinity Health who's trying to do it for their enterprise, but you need an organization that big that's willing to put out the money to sort of pay for that technology. And one of the things that we really, in the pediatric world, we have a lot of, I guess, what you would call orphan disease, and that we have kids coming from all over the state to see us. So we don't really have one payer system or one insurance system to sort of take care of all of population health. I would say that we are trying to build a system like that right now. So we're doing this with the T1D Exchange and the C3N network. So we're trying to create what Trinity Health does for their enterprise, but we're trying to do it for pediatric chronic disease management, right? So linking up centers from across the country, 67 plus, right? To one, have a system to share outcomes, two, to have knowledge networks. So, what Stanford does, we need to copy, and what we do, someone else needs to copy, right? And then three, just giving us tools to do data uploads for glucometers, because we don't have that right now, and to give us more tools for engaging patients in their care as well. So I really do think it's about, one, participatory design, because we're including patients in this process of design. Two, it's about systems design, right? So it's not going to come from that one provider who tries really hard in clinic. It's going to have to come from above to provide the infrastructure to equip providers to be more holistic providers. But I think the funding stream or the payment model for that has yet to actually support that.
Dr. Edington?
Yeah, I want to give a word of caution with these, what I call gee whiz things. But on the health side, not on the healthcare side, on the health side, it's becoming where I remember the words, and I wasn't there, but Henry Wadsworth Thoreau, Henry David Thoreau, 150 years ago, said there are a lot of tools out there. How long will it be before we become the tool of our tools? And then there's another website that just went up, well, a couple of years ago, called The Clinical Man. How many of you think your doctor wants it? In fact, if this goes far enough, you'll have a room or a person sitting there with 70 monitors around and looking at people, and you are one of those people. Do you think they'll be able to tell you what your state of health is at that time? Do you believe your state of health can come from? And I looked at the people, what hands went up with the bands around their wrists. All of you, a lot of you have those. A lot of you have cell phones. A lot of you are 24/7 now. A lot of you sleep with your phones, and you should find something better to sleep with than the phone. But there's another line to that, but I won't go to that line. So where are we going with this? Are we going to be all electronic, or are we going to be clinical? What about your brain? What about your attitudes? What about the way you're feeling? Yeah, you could probably monitor those too. So that's another thing to go up there. And then everyone in that room will know exactly what you're doing, but they won't. I think relationships are so much more important than these clinical measures. Now, not in the healthcare system, but I'm in the health side now. Relationships and how do we interact with people? That's where we get our health.
And are you talking about the interaction between patient and doctor, or the interaction between employee and...
Employee, coworkers, family, people-to-people interaction, not on the healthcare side, on people-to-people interaction. Your energy comes from people. Your health comes from people.
I think there's analogies for healthcare as well. I think there's such a focus on IT transformation and mobile technology and all the great gizmos that we can use, create, and wear, but I think there isn't a holistic approach to making sure the user has a say in how and why the technology would be used, right? If you let them design it, they will use it, and they will use it to the fullest, right? But I have a colleague who's a kind of a famous diabetes blogger, and she has this saying that, don't be an app hole, right? Like, she has type 1 diabetes, and she's got, you go to the app store, and there's thousands of diabetes apps, but none of them actually work for her for a variety of reasons. And so I think design for the user is how you direct and leverage the technology to be effective.
Good.
Right. Couldn't be more different, though. You're telling me to get online. You're telling me to connect to an actual face. Go ahead.
I'm just agreeing with you completely. I don't know about a lot of you out there, whether you've been to the restaurants lately. I'm sure everyone has been to a restaurant. My husband and I were just at Benihana's, and we're sitting there, and it's a restaurant where you watch somebody make food right in front of you, okay? So it's interactive. Everybody at our table was not talking to one another. They were just texting. And in fact, the mother and daughter that was sitting there for the whole hour didn't talk to each other at all. Nobody talked to each other. My husband and I were talking. We didn't have our cell phones out, but nobody interacted. And then everybody got up, and it was like, what kind of experience is this now? Have we gotten to this point? And it's just a comment. It's just a statement that I'm making. But have we gotten to that point? It was just unbelievable that day to really notice it, and it was glaring.
It's even more alarming as you're driving and the person next to you is driving like but I mean, all of us would agree that the connection needs to be person to person. It's the most powerful thing that we have. And yet, is it more important when we're talking about engaging people to perfect that connection between doctor and patient or inside the healthcare system? Will that be a better inspiration to the patient? Will the patient be a better inspiration to the front line, which, by the way, whether it's a doctor or nurse, is often not the inspiration of good health?
So I think there's a greater understanding that health is more holistic, right? And so, for example, for type 1 diabetes, I am not an expert. I manage it clinically. I am trained in endocrinology, but in fact, I have very little expertise in how to live with the disease and manage it, right? And so one of the things that we're developing with this learning health system is this whole notion of peer-to-peer networks, right? Because that's a really vibrant way that people are sort of not finding what they need from healthcare and finding it from the outside. But I think what we want to do is learn from the lead users, learn from the super users, maybe on some of these Facebook groups or some of these social media sites, right? And we want to take what they've done because they have expertise, they have knowledge, they have incredible wisdom, but we want to bring those models or systems back into the healthcare delivery system. So I don't think that, I mean, we see our patients every 4 months, right? But honestly, like, I think the therapy and the improvements in healthcare really come from connecting patients with other patients and letting their wisdom and expertise seed the healthcare system.
I would say that Joyce is a very unusual doctor.
I told you she speaks a weird language.
That's because I tweet.
Yeah, I do some tweeting, but most doctors, when they see they're working with people with diabetes, they say there's a diabetic. When I see somebody, I say there's a person with diabetes. Whole different approach. And I think the whole approach is absolutely necessary. And I think Joyce just said that's what she does, so that's good. I thought for once she was going to sit there in her old office and looking at people's A1Cs over in Europe or something. No, but it has to be holistic. It's not one disease. I got a friend that went in. The more you go into the doctor's office, the more things they find wrong with you. And one person went in for a back problem and had 37 different diagnoses. Saw 13 physicians at U of M. Nobody knew him. Nobody knew his history. Nobody knew who he was, but they saw that thing.
So you're convinced, at least from what I'm hearing, that social media plays a big part in saving lives for diabetics. I'd be more on the side of getting people moving saves lives for diabetics. And my question is, how are we going to get people moving?
Well, I work primarily with kids with type 1 diabetes. So
all right, so let's talk type 2. Let's talk type 2.
Yeah, so they're different populations.
So are you saying that social media doesn't play a role for type 2 diabetics?
I think it could be an ancillary thing. I think, yeah, they need to at least understand it and then get off of it.
How about a text in the workplace that says it's time to stand up? How about a reminder right here? Why don't you all stand up? Go ahead. No, I'm not kidding. Go ahead, stand up, stretch out, move. You've been sitting all together too long, and what would stop you from doing this in the middle of a 2-hour meeting? From telling people to just stand up and keep moving. Okay, you can sit down, that's enough.
You're an amazing person.
So regarding social media, I think there's a lot of fear around social media, and I think it's a generational thing, right? Like those of us who are a little bit older, it's sort of foreign. I mean, the kids, it's like not a big deal, right? It's not just diabetes. It's like I can't tell you how many interesting online communities there are that are leveraging social media. So this is just another example. This is a rare disease example, so this is different from sort of large-scale population health, right? But there's a professor at Utah who had a son with a glycoprotein deficiency or processing defect, and to his knowledge, he was the only person in the world who had this disease, right? So he actually wrote sort of a manifesto on a blog post, and he described all of his son's features, his clinical presentation, his test results, and posted it on Reddit, right, which is one of those sort of social media conversation sites. So he ended up connecting with a variety of other patients, right? His was the first, but there were 16 other patients that they found worldwide because of this blog post. The parents came together, they formed an advocacy group for the treatment, they brought together the clinical specialists in the arena. They're actually developing preliminary treatments in clinical trials now. So again, I think this is another great example of the positive effects of social media. I think physicians are very worried about the bad information that people learn online, but I think social media is a community just as this is a community, right? So if you as a healthcare provider or a healthcare system don't engage in the community, you don't have a voice in how the conversation is held, right? So if there is misinformation or if there are sort of wrong facts being disseminated about health, where are the physicians who are online in those communities dispelling the myths and, proponing the truth, right? To a patient community that feels like they can't reach healthcare in any other way.
Now, I don't have a doctor who's big into social media, but you had a couple of examples when I looked at some of your material, and there was a Seattle Mama Doc and Dr. Natasha, I think.
Yeah.
Can you tell us how they're using social media to engage people?
So they're pediatricians, but what they do is they blog, and Seattle Mama Doc in particular, she has a whole series called Seattle Mama Doc 101, where she films like 2-minute videos about, all sorts of pediatric issues like ear infections or growth, ADHD, autism, right? And it's just this notion that, we only have 10 minutes in the clinic. Like, we actually don't have a lot of time, and we have about 100 things that we're supposed to cover in terms of anticipatory guidance, right? So what they do is they put it online, right? People can watch it, and then it starts the conversation in a different place when you come in with your child, right? You've heard the spiel, right? You've heard the infographic, right? But then you can actually come to your doctor face-to-face with a better understanding of the disease or the issue or the concern, right? And then the conversation just goes that much farther because it's like Khan Academy for medical education, right?
Before I give them their pop quiz that they don't know they're about to get, is there anybody in here who can give us a really good suggestion when we're trying to engage our workforce, when we're trying to engage patients to be involved in health or healthcare? Any last comments? Yes.
Well, Kristen can talk about this. She's holding the microphone, but we've founded the chamber competition. Let teams compete.
Yeah, we had a weight loss challenge for the months of January and February. We had 40 members of our staff participate, and I think we lost 280 pounds or something collectively, but we're very competitive at the chamber, so it worked well for our staff.
And what will you do to sustain that?
Well, we have different activities throughout the year, but we have a wellness committee. So we just did a stress lunch and learn that builds on that, and what are some of the effects of that, and then we logged in a Google Doc what we're doing to manage our stress. So there's small things we do throughout the year.
And you always notice when it goes top down, it usually works better. Yes, go ahead.
Yeah, I was just going to say ask, don't tell. I mean, whether you're an Apple, whether you're an employer, once you start telling people, they turn off. Oh, hey, I was just going to say ask, don't tell. That's really close.
Yeah, I mean, I love the example of like DIY workplace wellness when the guy was like, oh yeah, everyone brought in their old like treadmill from their basement and then they brought it in together. I mean, I think that's, or even a committee, I think that's a great example of participatory design because it's like you have the people who are in the system creating the system that they actually want to use, and I think that's just much more effective than paying for a really expensive platform that, you know, that maybe people aren't so engaged in.
Yeah, I think this has to be a much sort of holistic solution, not the one-trick ponies, weight loss or exercise or so forth, but I think you have to find out what do people value. That's why I have shared value, shared results. What do the employees value? What do the company value? How do we get together and agree on the values? We're trying to develop intrinsic motivation. That's the one that's most likely to last. So let's talk to people and find out and ask them what they want. Ask them what their values are. And then how can we, to exercise your value, what do you need to do to show that's your value? How do you do that? And you get to help people think about that, because a lot of them haven't thought about their values. They should, but they probably haven't. They probably couldn't write them down. But give them a chance, and they will write them down. You know, it doesn't take a long time, but you have to invest that upfront time to understand your population, and understand the employer's view, understand the employee's view, and then come to agreement on what this is going to take.
One of the things that came out of this Join Me campaign was that Americans, for some reason, always think if you're going to exercise, you got to run a marathon. It's got to be so big and so huge. When really, we just want people to start moving. They don't have to finish the 10K. They just need to be moving. And so, if the two of you, and this is our final question as we end this session, were to come up with a PSA, a public service announcement tomorrow, and the public service announcement had to have 3 points, I want to know who is the audience, and what would those 3 points be? Go ahead, Dr. Edington. I'll start with you.
If you don't have eye contact, then you're not supposed to call on you. I didn't have any eye contact at all. Well, I would say that the one point is that we need to get more relationships in people. We need to trust people. Both management trust employees and employees trust management. I know some management don't trust employees because they want to do, blood tests for smoking and so forth. Let them tell you. What if they lie? So what? What makes the difference? They won't lie. They don't lie. So that's all when we have shared values, we understand each other's values. So I'm talking to the employer in employee groups and the UAW retirees. I worked with a lot of UAW people. And we just have to trust each other. And this is a labor management issue, in my opinion. And if management trusts the employees and employees trust management, we'll find a way to make time. Time is an important issue, but we can work that out.
Dr. Lee?
So I would say, don't design for me, design with me. That would be my logo. Mm-hmm. And I actually just wanted to part with this slide. What if this was your workplace? I'm not a workplace expert, right? But I think again, sort of going back to this notion of design and culture and, how do we make it so it's easy to be healthy inside the workplace? Or how do we make it so that our patients have all the tools they need to be the healthiest they can be with chronic disease?
So you heard it here. Connect with people, which we have done. Include the patients in the process as you make this new design. Embrace new views. Be ambassadors. Tweet. Inspire. Make sure that each one of you goes out of here, as we heard in the last section, and encourage other people to do the healthy things. And the best way you can inspire them is by doing them yourself. As we go forward, and this is the last session, I always wear turtles wherever I go. It's so easy to hide in your shell, but the only way you get something done is if you stick your neck out. So please, stick your neck out. Thanks so much.